Hi, everybody. A South Asian friend of mine recently asked me, tell me about skinny fat. How can you be skinny and fat? This question coincided with a question that's been nagging at me for a while, which is I work in San Francisco and I see a lot of Asian patients there, many of whom have diabetes. And I was taught in medical school that obesity is a leading driver of type 2 diabetes. And I'm seeing all of these Asian patients who are lean, yet they have diabetes. And I came across this graph from the 2020 US Census data that just blew me away, which showed that non-white Hispanics had a prevalence of type 2 diabetes around 12%. And then you get to Asian subgroups, Chinese, Japanese, much higher than that. And then you get to South Asians and Filipinos, and it's 30%. That's 1 in 3 South Asian or Filipino adults living in the United States has type 2 diabetes. Incredible. And it's not just diabetes. Kaiser Permanente here in Northern California, where I live, looked at a study, looked at their data, and found that South Asians had twice the incidence of coronary artery disease as white patients. So, what's going on here? And could visceral fat be the answer? So, the term skinny fat actually has a medical term associated with it too, which is normal weight obesity. And that is when you have a normal BMI, body mass index, but you have high visceral fat. Visceral fat is the fat that's deep in our abdomen, hidden away, coating our liver and our pancreas and our other organs. And it turns out that this type of fat is particularly toxic. Visceral fat is a leading driver of insulin resistance, type 2 diabetes, hypertension, and cardiovascular disease. And we know that visceral fat increases as we get older. It increases in women who are undergoing menopause, increases with smoking and sedentary lifestyle. But how about ethnicity? Do certain ethnic groups, like South Asians, have more visceral fat? And it turns out the answer is yes. A couple of different groups have studied this and done CT scans and DEXA scans looking at various ethnic groups and have found that at the same body mass index, Asians, particularly South Asians, tend to store more of their fat as visceral fat. So just checking a weight or a BMI in an Asian patient may be insufficient. A better measurement is waist circumference. And I wish that doctors routinely checked waist circumference just like we check blood pressure and weight. And for the general population, if you're a man and your waist circumference is 40 inches or greater, or you're a woman and your waist circumference is 35 inches or greater, that puts you at high risk for having large amounts of visceral fat, and therefore all of the disease consequences that follow from that. But if you're Asian, those thresholds are actually lower. So Asian men above the age of 40, above a waist circumference above 35, should be considered suspicious for having visceral fat that's in excess. And for women, it's only 31.5 inches. If you wanted to get a more precise quantification of visceral fat, you would want to get a DEXA scan. This is an inexpensive test that you don't need a prescription for, that exposes you to a low dose of radiation and can quantify how much visceral fat that you have. And for a man over the age of 40, you want to be under 2.2 pounds. And for a woman over the age of 40, you want to be under 1.2 pounds. So how can we lose visceral fat? Let's say you are an individual who has higher level of visceral fat than you would like. Well, it turns out the good news is what we know about weight loss also applies to visceral fat loss, which is the basic principle of a small, sustained caloric deficit over time. That will help with both weight loss, general fat loss, as well as visceral fat loss. Some strategies that can be helpful here is to stop eating after dinner, because most of us after 7 p.m., let's be honest, are not eating healthy foods. Another strategy would be to reduce consumption of ultra-processed foods, which are both high in calories and circumvent our satiety signals so that we keep eating and eating even when we're full. Eating adequate protein and fiber can also help with satiety. And then eliminating or reducing alcohol intake can help with visceral fat as well. Beyond diet, we know that high intensity interval training can be very helpful for fat loss, including visceral fat loss. There was a large meta-analysis that looked at 79 randomized controlled clinical trials and found that high intensity interval training was superior to moderate intensity continuous exercise for fat burning. I would also include strength training at least 2, maybe 3 times a week to maintain muscle while you're losing weight. And finally, often overlooked is sleep. Prioritizing sleep is very important, even when it comes to fat loss, because sleep deprivation elevates cortisol levels, and cortisol directs our calories to be stored as visceral fat. And when we're well rested, we also know that we make better decisions about the food that we eat. So, the curse of being South Asian. We know that visceral fat is toxic to our health, and we know that Asians, particularly South Asians, store more of their fat as visceral fat. I would advise getting a DEXA scan, especially if you're South Asian, so that you can quantify your visceral fat with your goal of being under 2 pounds. And don't settle for being skinny fat, because skinny fat might look good on the outside, but it's not healthy.